Are you near 40? Then it is important for you to be serious about your heart health. As you are nearing 40, high blood pressure, high sugar and high stress can lead on to various heart diseases, especially heart attack and heart blockages. So that's why it is important to know about how to prevent those. In today's video, we'll discuss about exactly the way you can prevent heart attack or heart blockages, especially if you're nearing your 40s, because in today's world, heart attack and heart disease is very prevalent among the young age groups. So heart attack rises exponentially after the age of 40, and there are a few reasons behind that. As a practicing cardiologist, it is my job to educate the general population about the preventive aspect of cardiology, because I do not want my patients to come to my operating table. I want my patients to come to my OPD. So that's why I'm interested in giving my patients the preventive aspect of health. And being a doctor over the last 25 years and doing a practice of cardiology, and especially having worked in renowned institutions like CMC Vellore, I've gained enough experience to share my personal experiences with my audiences. So as heart attack increases significantly after the age of 40, there are many reasons behind that. The first and foremost is that as we age, our blood vessels become stiff. So we tend to develop high blood pressure or hypertension. Our metabolism slows down. We tend to develop more fat, especially abdominal fat. And this abdominal fat is very bad for our health, because of this abdominal fat, there are lots of downward effects. Like because of abdominal fat, we tend to develop more high BP, we tend to develop high blood sugar, we tend to develop fatty liver disease, we tend to develop high uric acid, and all this can lead on to heart attack or heart blockages. So in order to prevent those premature heart attack, you can do few lifestyle changes, and these lifestyle changes are very easy to do. You need not spend a huge amount to undergo these lifestyle changes, and if you do these lifestyle changes which are scientifically backed, you can prevent yourself from a premature heart attack. Out of this, the first tip that I'm going to share with you is 10-minute rule. So what is this 10-minute rule? The 10-minute rule says that after a meal, if you walk for 10 minutes immediately after a meal, it decreases your blood sugar significantly to the tune of 30%. Walking has different advantages. All of us know that. Walking decreases high blood pressure, walking elevates your mood, walking decreases your body weight. But do you know walking has significant impact on blood sugar regulation also? As I have already told, if you walk immediately after taking a meal, you can decrease your sugar by up to 30%. And it has been seen that after taking a meal, when your blood sugar increases, that is known as postprandial blood sugar elevation. And this elevation of blood sugar, irrespective of whether you are diabetic or not a diabetic. In non-diabetics also, whenever we take food, there is a blood sugar elevation after taking food. So even if you are not a diabetic, your blood sugar will raise significantly after taking food. And this blood sugar rise will cause inflammation. And this inflammation can lead on to heart blockages and heart attack over a long period of time. So if you can curb the rise in blood sugar level after food, it can significantly impact your risk of having a heart attack or heart blockages. So thereby, after every meal, if you can walk at least for 10 minutes, it can significantly decrease your blood sugar, and it significantly decrease your chances of having a heart blockage or heart attack. That was the secret number 1. Now what about secret number 2? The secret number 2 is correct your magnesium deficiency. What is magnesium? Magnesium is basically a mineral, and this mineral is having lots of physiological function. Magnesium takes charge of around 300 or more enzymatic reaction in our body. Magnesium helps in regulation of our blood sugar. Magnesium helps in regulation of our blood pressure. Magnesium helps in the weight reduction. Magnesium is important in nerve and muscle functions also. So magnesium has various roles, and magnesium has a role in heart as well. In today's world, our food is magnesium deficient because we are taking more of a processed food. And ideally, we should have a magnesium of 400 mg per day in our diet. But in our diet, it is magnesium deficient. So we are chronically magnesium deficient in our body. So what role does magnesium play in our heart? Magnesium helps in relaxation of the blood vessels. So thereby it decreases the blood pressure. Magnesium also stabilizes the heart rate. Thereby it prevents arrhythmia or sudden cardiac death. Third, magnesium decreases the inflammation, and thereby magnesium helps in preventing a heart attack. So magnesium has threefold role as far as our heart is concerned. So that's why it is important to consume a magnesium rich diet in order to have a healthy heart. So there are various food items which are magnesium rich. The most magnesium rich food is pumpkin seeds. Pumpkin seeds are number 1 in the source of magnesium, along with spinach. Spinach also is a very good source of magnesium. And nuts especially almonds, cashews, pistachios. These are also rich source of magnesium. Along with these three sources, there are other sources also magnesium also. In whole grains, predominantly millets are a good source of magnesium, and quinoa also is a good source of magnesium. Fruits like avocado and banana is also a good source of magnesium. Along with, if you are a lover of a dark chocolate is also a good source of magnesium. Dark chocolate actually should have at least 70% cocoa to call it as a dark chocolate. If it is less than 70% cocoa, it is not a dark chocolate, it is more of a milk chocolate. So these are the magnesium rich foods. So as I am showing in the chart, the pumpkin seeds is a very rich source of magnesium. You should incorporate pumpkin seeds in your diet so that we are not magnesium deficient. Per 100 gram of pumpkin seeds contains more than 500 milligram of magnesium. Along with almonds and spinach also are good source of magnesium. So having said that, secret number 2 was you should take care of magnesium. You should incorporate magnesium rich diet. Third secret that you need to have in order to decrease the risk of your heart attack is you should decrease your stress level. In today's world, all of us are stressed because of personal issues, because of financial issues, because of professional issues. All of us are stressed, and stress increases the risk of heart attack by twofold. How does stress increase the risk of heart attack? Because stress leads on to release of stress hormones, and these stress hormones are adrenaline and cortisol. And adrenaline and cortisol causes inflammation in the body, and inflammation, once again, as we have discussed previously, can lead on to heart blockages and heart attack. So not only inflammation, adrenaline and cortisol causes high blood pressure because that causes constriction of the blood vessels as well as increased heart rate. So owing to all this mechanism, high stress, persistently chronic stress can lead on to heart blockages and heart attacks. So it is important on our part to get ourselves relieved of chronic persistent stress. So now next question comes, how do you get ourselves relieved of persistent stress? There are various mechanisms by which we can get relief of chronic stress. Number one is that you should pursue some hobby, whatever hobbies you are having. You might be having a hobby of reading something, somebody might like gardening, somebody might like listening to music, whatever might be your hobby, but at least pursue some hobby. Second, you should give some boundary as far as how much work you need to do, because work is otherwise endless. So you need to cut a boundary. So how much work you need to do, work-life balance. Third, you should do some breathing exercise, meditation. And as far as breathing exercises are concerned, there are few breathing exercises we can do. If you do it, it reduces your level of stress. The number one breathing exercise is box breathing. So what is a box breathing? Box breathing is a breathing exercise where to the count of 4, 1, 2, 3 and 4, you take inhale to the count of 4. So you take a breath up to the count of 4, then hold it for 4 counts, then exhale for up to the count of 4, then once again hold it for 4 counts. So it becomes a box. Inhale 4 counts, hold for 4 counts, exhale for 4 counts, and hold once again for 4 counts. So if you do this box breathing, it decreases, it has been shown in research, it decreases your cortisol level. And by decreasing cortisol level, it decreases our inflammation, decreases our stress. So if you are feeling stress in a day, few times you can do a box breathing. Second you can do is that another type of breathing is known as 4-7-8 type of breathing. That means you inhale to the count of 4 through your nose, then hold it for 7 seconds, 7 count, and after holding, you exhale through your mouth, not through your nose, through your mouth, exhale through your mouth to the count of 8. So short inspiration, shortish inspiration, then hold, then exhale. So this prolonged exhalation causes your activation of parasympathetic nervous system, and parasympathetic nervous system activation gives us calmness. So it decreases our stress level. So whenever you are feeling stress, you can do this 4-7-8 breathing. You can do 3 times, and after that immediately you can feel that your stress level, your anxiety comes down significantly. So these 2 breathing practices you can do. Third, what you can do is that you can do a diaphragmatic breathing. So normally we breathe through our chest. Whenever we breathe, our chest expands and comes down. We do not breathe through our abdomen. In diaphragmatic breathing, what we do is that we breathe through our abdomen. So what you can do is that you put your palm, one on the chest, another palm on your abdomen. And when you are breathing, your hand on the abdomen should move. That means you are breathing through your belly, not through your chest. So whenever you are breathing through your belly, your diaphragm, which is a muscle between your chest and abdomen, undergoes contraction. And whenever you are having a diaphragmatic breathing or a belly breathing, it increases your oxygenation to your heart and other organs significantly. So by doing these 3 breathing techniques, your diaphragmatic breathing, 4-7-8 breathing technique or box breathing, you can significantly decrease your stress level. So this was so especially it has been shown in various studies, especially Stanford School of Medicine had shown that if you do at least 5 minutes of this exercise per day, it decreases significantly your heart rate, it decreases your blood pressure, it calms you down, it decreases your anxiety level, and it decreases your stress hormone level. So by doing at least 5 minutes per day of breathing exercise, it decreases your stress level significantly. So we have already discussed regarding the stress as far as reduction in your risk of heart attack. Fourth secret that I would like to share with you is sleep. Sleep is something which is very, very important. Sleep is like a repair. The wear and tear that we go throughout the day, whenever we sleep, our body undergoes repair, it undergoes rejuvenation. But when we are chronically sleep deprived, when we are not sleeping properly for a long period of time, it increases the risk of heart attack up to 50%. There's a significantly huge amount of risk involved in poor sleeper. So that's why you should have a good night's sleep. On what account the sleep increases your risk of heart attack? Sleep, because of poor sleep, your stress level increases, your cortisol increases, which is a stress hormone. And because of cortisol, increase in the cortisol, our inflammation in the body increases, our blood pressure increases, your blood sugar increases, our hunger hormone increases. And because of hunger hormone, whenever we are sleep deprived, we tend to overtake food. We tend to take more food, we tend to take more junk food, and thereby we tend to gain more weight, we tend to develop more cholesterol because of poor sleep. So poor sleep can lead on to heart blockages or heart attack because of all these mechanisms. So that's why it is important on our part to have a good night's sleep, and there are various ways you can have a good night's sleep, that we call it as a sleep hygiene. First and foremost is that you have to have a persistent timing. That means the time when you are going to the bed and time when we are waking up, the time should be almost constant. Half an hour plus minus is okay, but it should be as constant as possible, because timing is the king as far as proper sleep is concerned. Second, that you should avoid tea and coffee consumption close to bedtime. You can take in the morning, but beyond afternoon you should not take it. You should limit the use of gadgets, especially 2 hours before going to bed, because gadgets, especially phone, tablets or laptop screen, emits a blue light which prevents our sleep. So these are the few things, and especially avoid late night eating. You should finish your dinner as early as possible. At least keep it 3 hours gap between your dinner and bedtime. So these are the few things which if you can do, you can have a good night's sleep, and thereby if you have a good night's sleep, you can prevent your premature heart attack or heart blockages. What about the last secret? The last tip that I would like to give you regarding prevention of heart attack or premature heart attack is omega-3. So omega-3, all of us know, is a fatty acid, and this is a fatty acid which reduces inflammation in your arteries. So omega-3 has various roles in our body nowadays. That we take less of omega-3 because our diet is loaded with omega-6, because we take more of a processed food, we more take outside food, we take a restaurant food, our food is rich in refined oils. So that's why our diet is rich in omega-6. So our diet is more of an omega-6 and less of an omega-3. So there is an imbalance between omega-6 and omega-3. Normally omega-6 and omega-3 should be in 1:1 intake, but in today's our diet, because of a processed food intake, outside food intake, junk food intake, omega-6 omega-3 ratio becomes not only 1:1, it becomes 20:1, even sometimes 50:1 also. That means it's omega-6 loaded and omega-3 deficiency. So in order to prevent that, we need to take more of an omega-3 in our diet, because omega-3 has various roles in our body. Especially it is good for our brain, good for our eye health, it's good for our joint, and especially good for our heart as well. Omega-3 prevents inflammation, thereby prevents heart attack. Omega-3 decreases our triglyceride, which is a risk factor for heart attack. Omega-3 stabilizes our heart rate, thereby prevents a sudden cardiac death. So that's why omega-3, proper intake of omega-3 is very important for your heart health. So what are the food sources which are rich in omega-3? Especially plant-based sources like walnuts, flax seeds and chia seeds are good sources of omega-3. And in case of animal-based sources, especially fatty fish is a rich source of omega-3. So you need to check your basically omega-3 level in your blood. And how do you do that? You do that by checking an omega-3 index in your blood. So you can ask any lab to do this omega-3 index, and omega-3 level in your blood, if it is less than 4%, that means you are deficient. If it is more than 8%, that means you are sufficient. 4 to 8% is borderline. So if you check your omega-3 index, which suggests a level of omega-3 in your blood, if it is deficient, then you need to not only augment omega-3 food in your diet, but you need to reduce omega-6 intake in your food by decreasing or eliminating refined oils, eliminating processed foods, eliminating fried foods, eliminating junk foods. Along with that, you need to take omega-3 supplementation also. So thereby, if you combine all those three, you can decrease your risk of premature heart attack or premature cardiac blockages. Out of that, first rule is you walk after 10 minutes at least after taking food. You should have enough magnesium in your diet. Third is you should do stress relieving activities, especially breathing exercises, meditation, pursuing some hobby. You should have a good night's sleep. You should follow the sleep hygiene, as well as you should have proper omega-3 in your diet, reduce omega-6 intake, and sometimes you check for omega-3 and supplement with an omega-3 capsule. So if you follow all those things, it will prevent you from having a premature heart attack and can lead on to a healthy life. Being a practicing cardiologist, it is my duty and responsibility to bring out preventive health aspect in front of you. So if you like the content, whatever we have shared with you, kindly subscribe to our channel. And